I'm going to get started. We have a huge program in front of us, and I want to make sure we have adequate time for everybody to get a chance to speak, listen, ask questions. I'm Lori Hoagland. I want to thank all of you for participating in our public forum on the Jackson County Deflection Program. The Surgeon General's report on alcohol, drugs, and health, released in 2016, defines substance use disorder as a clinical condition that impairs health and function, not a flaw in a person's character or morality. It's exciting to see increasing opportunities for treatment rather than criminalization in our community. I want to thank the steering committee of the Jackson County Deflection Program for showing up tonight to explain their program to us. We believe that learning about this program at its beginning will help create trust and understanding and support for deflection over time. I am chair of the Rogue Valley Healthcare for All Oregon. We support healthcare as a human right, striving to provide high quality, efficient, and affordable care for all Oregon residents at their time of need. Deflection will help us expand medical care to many in our community that don't have access at this time.
So I'm Karen Caldwell. I'm a member of the Community Engagement Committee. Our group is made up of people with lived experience and with family members of folks who have behavioral health challenges. Behavioral health includes both mental illness and substance use disorder, as well as dual diagnosis, that is, people who deal with both mental illness and substance use. We advocate for services that will meet these particular needs, and we hope that the new deflection program will expand the number of people who can be served rather than criminalized. Thanks.
And I'm Andra Hollenbeck here with NAMI Southern Oregon, and we work to improve mental health care through support, education, and advocacy. Part of our advocacy is holding forums on mental health issues like this, and of course, according to the National Survey on Drug Use and Health, 17 million U.S. citizens, adults, experience both mental illness and substance use disorder. And so there's a cross section there. And so we're here to just learn more and support public education on this very important issue and the deflection program. Thanks.
So I want to give everyone an idea of what our plan is with the forum tonight. We will first hear from our legislators, Pam Marsh and Jeff Golden, and then the steering committee have a presentation on their program, which they will do next. And then we will have question and answer period and closing comments. Please put your questions in the chat. We only want questions in the chat so our audience can focus on the program and not get distracted by chat reminders. And then Andrew will collect the questions and put them together when we get to the Q&A time. Thank you. Okay, so now I would like to have Pam and Jeff please speak.
Pam, do you want to kick off or would you like me to?
Sure, I'll kick off. You can add in all the things that I've forgotten to say. First, good evening, everyone. It is lovely to be with you, even virtually, and I want to thank Lori and the team for pulling this together. We've known from the beginning that really transparency around the changes that we are experiencing, that we've implemented at the legislature, is paramount. We all need to understand what the new systems are going to be, how they will function, and that way we can support individuals that we know, that we come in contact with, who may be going through the new programming. So first, we'll just start off with a little bit of background. You all know that Measure 110 passed in 2020, a result of a citizen-led initiative. It passed across the state. It passed in Jackson County. However, over the next couple of years, we began to see the public, frankly, sour on the decriminalization that was part of Measure 110. I believe that a lot of that was a conflation of other big issues that were also happening in the community. We'd seen a surge in homelessness. We'd seen an increase in overdoses as a result of a tsunami of fentanyl coming into the community. And we'd seen Measure 110. All of those are separate issues that need separate responses. And yet there is some overlap. And in the public's eyes, the frustration that they experienced on many of those different fronts began to center on Measure 110 as people began to think about whether or not they've made the right decision. This came to a head in the 2024 short session in March of this year. And the legislature was confronted with two realities. Number one, we saw polling that showed that members of the public no longer had faith in the decriminalization approach. Number two, we knew that there were a number of advocates out there who were pitching a very well-funded initiative that, if successful and placed on the ballot, would have had a fairly dramatic repeal of Measure 110 and done in a way that the legislature would have very little ability to change or modify. So with those two stark realities, plus I believe a genuine intention on the part of the legislature to try to put some reforms in place that would function better, that would get people to treatment in a more expedited way than we'd experienced over the last couple of years, and that would start to rebuild confidence and trust in the system, we moved forward with reform legislation. And you may hear that referred to as House Bill 4002. There was a second bill as well that had some of the funding obligations contained in it. But the bill aspired to take a very broad approach to understanding that when we address addiction, this is not just a matter of criminalization, it is very much a matter of making sure that we have the supports, the systems, the services that are necessary for someone who is in the throes of addiction. And we did a number of things. Number one, we'll just get it out of the way. We recriminalized possession of small amounts of illegal drugs. Number two, we did that at a low-level misdemeanor. It's a lower-level misdemeanor than existed before Measure 110. Number two, we put deflection programs in place, or we put the opportunity for deflection programs in place. We encouraged, through the legislation, counties to create pathways for people who are picked up for possession to avoid the criminal justice system entirely, but rather to work through law enforcement to go directly to treatment. The design of those programs was up to the counties. Even whether or not to go down that path was up to the counties, but there was strong encouragement to do so, and we set money aside in the Criminal Justice Commission to support the counties that chose to create deflection programs. We also funded a number of supportive services. We supported a program to allow our jails to implement medication-assisted treatment. It certainly makes sense when you have somebody in jail to be able to offer them assistance at that moment. We put money into behavioral health development. We put money into the nonprofits that work with our families that are very often in the throes of addiction, along with other issues. We put money into recovery housing. So that's the package that we passed in 4002. We then handed the responsibility for putting deflection programs over to the counties. We know that 28 of 36 counties, at least at my last count, have gone forward with deflection programs. And I think here tonight, we're going to hear what Jackson County's program looks like, and I'm anxious to get that report. I would also note, on a little bit of a sobering front, the law changed to allow criminalization as of September 1st. Our deflection program isn't quite in place yet. Jackson County has been arresting people, and I think it would be valuable for us all to know sort of how we're handling this interim period so that we can be as supportive as possible. But that's the background that the legislature brings to this discussion. Jeff, what did I forget?
Very, very little that I can think of. That was a good layout of how we got here in terms of legislative actions. You know, when Pam and I both supported House Bill 4002 that kicked off the process we're now in the middle of, and I was thought it was unfortunate the way pardon me, the way it was kind of framed in the public consciousness as a return to the war on drugs, or leaving things exactly as they were. A very major factor in a lot of our calculation was the ballot measure, the prospective ballot measure that Pam talked about. And my judgment was that it would have set back our state considerably and not had that ballot measure passed, especially with regard to mandatory minimum sentences for possession of drugs. And that would have been a full-on retreat to the war on drugs and all the damage that I think it demonstrably did to the country, criminalizing private use. And we, a legislative committee formulated the current program after a year of discussion, which seemed to me to be a much better outcome. But all of its success, the Measure 110 approach, the approach that we're now embarked on, all of it relies on adequate resources for treatment. And we know that treatment tends to be expensive. It tends to be long-term to be effective. I think one of the lessons of our experience the last few years is in the current environment, with the amount of homelessness and challenge and ready availability of lethal drugs on the street, a decriminalization by itself isn't going to work. It needs that sustained, maybe if we'd caught this 20 years earlier, this would have been less true, but it needs a sustained commitment to treatment. So those of us who agreed to this approach made a couple things very clear. One is that we expect a steady flow, not just in one session or two sessions, but ongoing, of significant dollars to treatment deployed on the community level by organizations rooted in the communities who know their communities. And the other thing that we insisted on was a very effective, accessible expungement program after people do the course of treatment, or in some cases, if treatment is refused repeated times, perhaps incarceration, that their offenses will be expunged. This is for private personal use of drugs. And because one of the most pernicious things about the war on drugs was the way people's record, even for simple possession, followed them for the rest of their lives, such that they never, I don't know what the count is, but probably millions of people never had an opportunity to adequate housing and employment again. So it ruined lives for lifetimes. And we have to be sure we don't return to that. Another part of 4002 was a pretty robust reporting system, such that, because one of the concerns was that, any kind of punitive purely law enforcement approach to the problem, that in our history was that it targeted people of color disproportionately. The data was pretty clear on that. And there was a lot of concern that that might happen again. That's the main reason. There are several reasons. That's probably the main reason that we need all interactions documented and recorded and sort of analyzed to see if the law is being applied in a just, non-prejudicial way. So all that said, Sheriff Sickler brought a lot of us together with some of the people we're going to hear from tonight about what Jackson County's deflection program is going to look like. I will say that I was really encouraged by what I heard, and a lot of it is the commitment of really qualified and committed treatment professionals in our county, the ARC, the On Track, and others, to making this work. And seemingly what seemed to me to be the openness and knowledge of law enforcement folks that collaboration was necessary really looks to me to be like a genuine collaboration and a real commitment to treatment. So that was great to see. And I think I'll leave it there. I think we need to really devote the bulk of our time to hearing from those folks and hearing the questions. I still have some, but the last thing I will say is where I started, which is I don't see a path to success without significant investment from the state and from, everywhere we can think of, private sector philanthropy, matching federal funds, to the expensive project of treatment that works. And I wish I were more confident than I am that the state's going to be able to sustain that commitment over the sessions to come. We shall see. But what state is now entering, I think it'll be very evident in the coming session. The state is entering a time where the massive accumulated needs in so many areas really dwarf our available revenue. It's sort of a lot of chickens coming home to roost at the same time. So we'll see how all that comes out. But we are going to have to really rely on our community wisdom. And I didn't say that another thing that encouraged me is the involvement of peers, peer systems, people who have history of substance abuse disorder and their close engagement with this project, which I also think is essential. So I'm sure Pam and I will both do what we can to get the state to meet its obligation of investment as long as we can. But we got a fiscal challenge coming up. Thank you so much for organizing this.
Okay, so now, Vicki, your group is ready to do the presentation. Great. Fire away.
All right, well, Vicki shares the screen. I get to go first. I'm Josh Aldridge. I'm a captain with the Jackson County Sheriff's Office, and I'm kind of here talking today on the behalf of Sheriff Sickler. I want to apologize for the fact that I know you guys can't see us very well. We wanted to make sure, we thought it was important that we were in the room together with each other as a group of people who have really been working, from our different diverse portions of this system to come together to come up with a plan. So first of all, can you guys see our slideshow right now?
Yes.
Okay, perfect. You can go ahead forward. I am actually going to skip through these first couple slides pretty quickly because we want to make sure we save times for questions. And Rep. Marsh and Senator Golden basically talked about everything in these first two slides. Really, the background of 4002 got us to where we're at today with having a group of people who the legislature encouraged to come together and work through a new entry point, one that's never really existed into treatment, I think, anywhere before. And that is that point where law enforcement first has contact with an individual. Here in Jackson County, and I think in many places, we have entry points to treatment potentially in all other intercepts of our system. Pre-contact with law enforcement, people have opportunities through pretty robust treatment provider networks here in Jackson County. If people are arrested and post-conviction and sentencing, there are opportunities, but there hasn't really been an opportunity at that point where law enforcement first interacts with them. And so the deflection process really provides that opportunity. It helps us with the funding piece. And I love hearing Senator Golden talk about the fact that, it will be a priority in the legislature because I think it's one of our biggest concerns moving forward. But like I said, I'm going to skip through these pretty quick. I'm going to leave them up long enough that you guys can read them. I think you will see that most of what's on these first couple slides are what was previously discussed. One of the things I do want to mention, because my official position with the Sheriff's Office is as the jail commander. And as you heard Rep. Marsh discuss, there's another portion of 4002. I think a lot of people hear 4002 right now, and they think about it as a recriminalization of drug possession and its deflection. And there are these really important other pieces. They'll be discussed a little more in our program. But the piece specific to the jail treatment grant is one that I'm personally really excited about. We're working on that now. And what that'll do is expand adults in custody's opportunity while they're in the facility to enter into a medication-assisted treatment protocol. We've actually begun those conversations with one of our community providers who can come in and do that initial assessment and entry, along with 3 separate peer organizations that will be able to come in and work with that population in our jail and also prepare them for transition back out into the community. So real quickly, before I pass it on to Jen, who's next, the way our program is going to look is a little bit of history of 4002. And then how forward from some of the relationships that already existed, we were pretty lucky to have, and then really getting into
said earlier that 4002 is a broad, there was a pretty broad bill. There are lots of different elements, and it's just that, as the captain just mentioned, think about the decriminalization piece and the deflection, but here are a few other components. The bill has some elements in it to help make access to medication assisted treatment, easier to obtain by making sure that we don't have prior authorizations mucking the process up to get started, and that pharmacists are able to dispense early refills and install drug blockers. It also expanded the certified community behavioral health clinic model across the state that had been a demonstration project in the state of Oregon. Oregon was an early adopter of the CPHC model, and now we get to expand further across the state. Captain just mentioned this opioid use disorder medication grant program. There are also elements in the bill to study barriers and best practices for youth. Now, this bill primarily did not address youth, it addressed adults, but it does add a piece here to study some barriers and best practices, as well as some focus on addressing the safety issues experienced by behavioral health workers. On the funding side, so the deflection program grants are funded in the same big amount that was allocated that goes through June 30 to just of next year. So we're already into a one-year program. The bill also funds the opioid use disorder medication grant that the captain referred to, and then a number of different expansions of existing approaches or service elements. For example, the jail diversion programs that are operated by the community mental health programs like ours at Jackson County Mental Health, specialty courts, that would be things like our wellness court, substance use disorder treatment capacity, youth outreach and prevention, and then much needed expansion of public defense legal representation. There are also some elements to help fund the administrative duties that are going to be associated with the conditional discharges and expungements and more. I just wanted to give you a flavor for the breadth of different tactics that this particular bill and the funding try to address, all in one fell swoop, with the deflection being one of those.
All right, back to me, and then I'll be done. I did want to throw out a little teaser because Rep. Marsh asked about this in her introduction. We do have, you'll hear from Rick Hawley from our circuit courts here a little bit later. We have some data on what's happened so far with arrests related to the U misdemeanor. So I just wanted to let that is coming up, and you'll get that information from us today. So once 4002 was put into place, and the Criminal Justice Commission, along with the planning committees, started talking about what deflection would look like for those counties who were interested. This next piece is kind of talking about how that came together. So some of the requirements to be eligible for the deflection funding piece, you had to be one of Oregon's 36 counties or the federally recognized tribal governments. And then there was really important information about who had to be included in the work groups that formulated each jurisdiction's planning. And so that had to include your community mental health providers, and then these required partners, law enforcement, the district attorney's office, somebody from the behavioral health resource network. And I really do believe that what set Jackson County apart from some of our counterparts in the state is that all of those people on the list and others who are included in these groups that are, kind of defined as the governance and the operational groups of deflection, we kind of already knew each other. At least we talked before if we didn't have a relationship. And so when it came to this point, when we were sitting down to talk about what deflection could look like and submit for our grant applications, we have been working together in this area for some time. Examples, and you'll hear more about how this is gonna start off with some of Metro Police Department's livability work. You know, many of the providers who are going to be a major portion of our deflection program were already working with groups like the Livability Team and those law enforcement officers to try to get resources for people in need. The deflection program coordinator was also a requirement in the grant application. And so that's where Vicki comes into play. We were really lucky to have somebody in our community who had also already been looking and working with this group of people in our community suffering from substance use disorder and trying to get those folks into treatment and the resources they need. And so Vicki is actually our interim deflection coordinator. She's kind of working in a part-time capacity at this point until we can establish how that position looks long-term. Along with Vicki and those folks here at the table, you can see this is a list of, and this list has continued to grow as we bring in new members of the community who are able to help us out. This is kind of where we started. The Sheriff's Office and Medford Police were the two law enforcement agencies who this will begin with. And I should say, and I think this is brought up several times through our presentation today, our intention is for expansion, but every piece of advice we've gotten has been to start small. And so this is where we're beginning. You can see our two major resource providers, On Track and the ARC, are here. They've been a part of the discussion since the very beginning. And many of the things you'll hear about that define how our deflection program will work and what success will look like came from those providers and their input. And then the courts and the district attorney's office and Jackson County Health and Human Services in a variety of different roles. The deflection grant was a formula grant. That's how it was determined by the state. So we kind of had an idea what Jackson County was eligible for when we entered into the grant application process. At the beginning of 4002, Jackson County had made itself available for some early adopter funds. And so right from the very beginning, we were able to get some funding and get started. As Jen talked about, this funding currently is only through June of 2025. And so there again, you know, bringing up once again the need for future commitment from the state, hopefully to help us with this. That grant allocates funding for the deflection coordinator position. It allocates funding for the behavioral health experts to be able to do their work, for the peer support specialists. And it really, you know, the intention of these funds is to funnel that down to ultimately that person who's suffering from substance use disorder who needs help, and making sure they get the help they need. And hopefully, you know, that'll have the long-term financial effect of helping them avoid, you know, utilizing other resources within the criminal justice system, within our medical community, if we can help them find sobriety. Some requirements for the deflection process that we have to make sure are in place as we move forward. CJC is working on how they're going to gather the data. Senator Golden mentioned how important it is that we talk about not only data tracking for those people who are involved, but also for those people who are offered deflection and opt out. And so REDCap is a database that has been used for some time with our health and human services providers. They're familiar with the software system. This will be an adaptation of a REDCap that's specific to deflection information. There's technical assistance that's been made available by this House Bill 4002. Both technical assistance specific to helping out Jackson County with our plan, and then kind of on a statewide level, we were able as a group to attend a regional technical assistance training in Bend. And really, you know, I've said it a couple times now, the advice from anyone who has had the opportunity to work in the deflection arena nationwide, or even there were people represented the international deflection programs, was start small. Get the important pieces in place and grow from those pieces as you find opportunity to expand. So you'll hear that here in Jackson County, we felt like we had some opportunities kind of in place. We have some specific groups that are working with probably our highest need population. And so we're really focused on starting with that group, finding ways to help them through their process in what we feel like is a smart and intentional approach to that, and building and expanding access to the deflection program as we move from that. And so I think we are ready to start talking specifically about our program. So I'm going to pass it on to Lieutenant Biela from the Medford Police Department, who's going to talk about how this is going to work.
I'm Rebecca Pietola. I'm the lieutenant for the Medford Police Department. I'm currently assigned to the Community Engagement Division, which houses our Medford Police Livability team. And as you'll hear, they're one of the groups that will be starting off with this program. So I'll talk a little bit about what is deflection. And really that's just an approach for us to connect folks to supportive services in lieu of criminal charges when we're dealing with substance use disorder and behavioral health issues in the community. So it's a pre-arrest opportunity for them to engage with the service providers within our community. So the eligibility criteria for our program in Jackson County is they have to be an adult, 18 years or older. They cannot currently be on supervision through Jackson County Parole Probation. They cannot currently be in deflection, and I'll talk a little bit more about that as we go. And they have to be willing to engage in this program. So as you'll hear from our service providers later, there really needs to be a want to change, a want for treatment, and a willingness on their part to engage in the program. It's going to be a lot of work for them, and that's intentional. We think accountability is important in this program. So there are some things that they'll have to accomplish, and you'll hear a little bit more about that as we go through and talk about our program. So right now we are doing the eligible crimes. We're again starting small with this and very intentional. So we are starting with the unclassified misdemeanor or the drug enforcement misdemeanor, the DEM charge. That is really a small amount of drug possession, user amounts, residue amounts, those types of cases. We recognize within the work that we're already doing that oftentimes those crimes or that level of crime is associated with other nuisance type livability issue crimes. The other two crimes that can be in conjunction with this unclassified misdemeanor are a trespass or a disorderly conduct. Those are the only crimes that we're going to consider at this point. Anything else oftentimes has a victim attached to that, and we're not going to pursue those charges through deflection. So you'll see if they've got the unclassified misdemeanor, controlled substance offense, they are eligible for this program. If they have the unlawful possession that is above an unclassified misdemeanor, so if it's a misdemeanor or a felony, they wouldn't be eligible for this program. And they'll be eligible through other means, and they can certainly get treatment, but it won't be through deflection. So when we enter a person into deflection, we're going to offer that in the field. So we will encounter somebody with the crimes that have been previously mentioned, and we'll, based on the eligibility criteria, determine if they're eligible for our program. If they are, we will fill out a participant agreement form. The important part about this form is that we are going to fill this form out every time deflection is offered. Again, to kind of talk about what the senator mentioned, to be transparent with who we're offering this program to, whether or not they accept or decline, that data will be tracked. And then we're going to do a warm handoff to our service providers. And right now what that warm handoff looks like is law enforcement taking that person and that participant to their service agency. So whether that's on track or the ARC, we've developed a system to equally distribute those clients. And the client can also have input on if they'd rather work with a certain organization or their other. We're going to allow some flexibility in that. There'll also be some flexibility in the field that if there are barriers to folks being able to be transported to the facility, that a peer could be brought out into the field or come out into the field to connect with that individual. So we're working through that, and that will be another means to connect in that warm handoff. Piece is particularly important for our program. We think that will help with engagement, and they can really start the work day one, and you'll hear from that service providers on that end. So for us operationally, a lot of this will look the same. We will have that contact in the field. We'll see the evidence as we otherwise would with any other charge. We're going to issue a citation with a court date that's 90 days out. And the reason for that is it gives them time to complete this program. If they successfully complete this program, they will never have to appear in court. That report will never be sent to the DA's office, and there won't be a charge that's filed for that. So you'll see the citation will just be kind of lying in the background in advance until we determine a successful completion or a failure in the program. They'll be introduced to that peer. The paperwork will be filled out. We'll generate a police report, but again, our agency will hold on to that police report, and it won't ever go to the DA's office until we get information that that participant wasn't successful in which case the charges will be filed. So for our program, this is just kind of the kickoff date to let you know what we're doing. So October 7th, 2024 is our start date. So we're going to go live with that. We actually had a training session this morning with our law enforcement teams that are going to be starting with that. Initially, it's going to be the Metro Police Livability Team, as well as the Jackson County Sheriff's Office Community Outreach Deputies. And the reason, again, like Captain Aldridge mentioned, the information that we're receiving was start small. And the reason that we chose this group of officers is they've already been doing a lot of this work with our local partners and service providers. They've already been doing outreach. We do outreach currently with the Metro Police Livability Team twice a week. And so that was just a kind of a continuation, a natural bridge, and just a good opportunity for the deflection program to start in that arena. And then we can expand from there once we determine what the capacity is and what that looks like. In our training this morning, we really talked about having open lines of communication, week to week, day to day on what this looks like for us. And we can adapt and be fluid and make changes as needed. We've got a great group of officers that are going to kick this off. And we want to promote this and get started on the right foot in order to make this program successful for our county.
Which one? Me. As the. Hi, everyone. I'm Summer Walcott. I'm the Executive Director at On Track. And I'm talking about what it looks like once somebody is deflected to either On Track or the ARC. And so both of our agencies have a team of peer support specialists there that have their own experience with substance use or mental health or both, that will be the first point of contact, because we want to be really welcoming during that intake process. So they'll be the first point of contact and will, help kind of walk the person through what the process is going to look like, do a screening to figure out if there's immediate basic needs that need to be addressed, things like food and shelter, and we'll get them ready to meet with one of the certified alcohol and drug counselors for an assessment. When we designed this, we were really trying to think about how are we going to have the maximum impact in a short amount of time, and what can we do to really build a relationship as quickly as possible and deliver the types of services that will make an impact, even if the person isn't successful in the actual deflection. So one of the requirements is that they have to complete a full assessment with a certified alcohol and drug counselor. What that will do is help us determine the appropriate level of care that the person would benefit from. So they might need detox, or they might need residential treatment. And that assessment's enough to get them placed on wait lists for the correct level of care across the state. Because sometimes the wait list is lengthy. It will also help then with the next step, which is to create a service plan or an individualized treatment plan that really is kind of the working with the individual to map out their treatment goals and objectives and kind of the plan for how to walk them through that process. So in order to successfully complete deflection, they have to have a total of 10 contacts with our peer supports and treatment staff. So that could be, 5 peer support meetings and 5 treatment team meetings, or it could be more meetings with the treatment team and maybe just 2 or 3 with the peer support, really depending on what it needs. The minimum is 5 treatment contacts, and that's really so that there's enough time to get some momentum going with them in individual counseling group and get them on the correct levels of care. That way, if they do step out of deflection early, or they complete and they stop coming back in for services, when a bed becomes available for them, it's another opportunity for us to connect with them and say, hey, your bed is ready. Are you ready to go into residential treatment, or are you ready to go into detox? So yeah, all those things are what I said. There's weekly case conferencing that will happen with on-track's peers, the ARC's peers, and the deflection coordinator to review the progress and kind of talk through how it's going for each person. We also have the opportunity between on-track and the ARC. If somebody is not doing well with us, or they would benefit from a service that the ARC offers, we currently regularly, refer clients to each other. And so that'll be an opportunity to make sure that they're getting the right services based on their individual needs. Within the 30 days, if they've done the 10 treatment engagements that they have completed successfully, and our goal is to keep them engaged in treatment long after that. But it's that those first 10 contacts results in them being successful. Ben, do you have anything to?
I can jump in. My name is Ben. I'm a peer program manager for the ARC. I just want to go over and emphasize a lot of what Summer shared. The peers that are going to be associated with this program are people with lived experience, many with both mental health and substance use disorder. And these people have been through the criminal justice system. They've navigated the road of recovery in this community. They're super passionate about what they're doing. I'm super passionate about what we're doing. Our ongoing relationships, although this is starting with a warm handoff from a law enforcement officer, it creates just another door to programs that we've already been successful with and programs that we've already been working on. So we create these relationships with individuals that last sometimes many years. And we have the ability to follow these people, not just through the deflection program, but through every level of care, from withdrawal management right in the beginning, all the way through transitional living and maintained sobriety. So got the best people delivering the services as possible, I believe.
So I'm Patrick Green. I am currently the Chief Deputy DA, and I am the incoming DA starting in January of next year. And so what you're looking at right now is a simplistic view of what results from a successful completion and then an unsuccessful completion of deflection. And so obviously we would love for everyone to be on the successful side, which would result in no charges being filed by our office and result in no kind of criminal record for the individual. The reality is we know there are going to be people that don't make it through deflection or aren't interested in it after being offered, or because we're starting small, may not have the opportunity up front to participate in deflection. And the important thing to keep in mind is those individuals, even once criminal charges are filed, will still have the opportunity for off-ramps if they're willing to engage in treatment to really minimize the impact of that criminal charge or conviction that results. And so really the framework that was in House Bill 4002 with this new misdemeanor charge really broke it down into really 3 stages. And in each stage, that person has the opportunity, if they're willing to engage in treatment, to get a form of leniency. And so really the first stage, you heard mention of it earlier in some of the slides, was a conditional discharge. And so House Bill 4002, after charge is filed, mandates that the person has to be offered a conditional discharge unless the DA objects, and then a judge still may offer it to the person over the DA's objection. And to give you kind of an idea, our office is being very limited in which cases we object to. You're going to hear about more stats in a little bit from the court, but we've filed 64 of these charges so far in our court, and we've only objected 1 time. And that was for somebody that had a very substantial, lengthy criminal history, and we just did not believe that the conditional discharge had utility for them. And that individual also wasn't interested in the conditional discharge, it turned out, even after the judge was willing to have them do it over our objection. So we are trying to be limited in that, and you also hear later on from probation that really the conditional discharge is probation. The person has a probation officer, and so it looks very much the same as what somebody would be ordered to do on supervision after conviction. So it doesn't really make sense for our office to be objecting a lot of times to conditional discharge, since it looks very similar to regular probation. So conditional discharge, it doesn't require any kind of plea. The person, and of course, no conviction. They are basically entering into an agreement to be on probation for 12 months, and you'll hear a little bit later about what is required of them. Obviously, engaging treatment will be required. And then at the end of that 12 months, if they're successful, the charge is dismissed without a conviction, and then the record is expunged automatically within 90 days of that occurring, to really minimize that impact, that lasting impact that a criminal conviction may have. For someone that maybe doesn't have the opportunity for conditional discharge, or that they don't take advantage of the conditional discharge, or may not be interested, the second stage is where they may end up with a conviction and then a probation sentence, where again, they'll be mandated to engage in treatment. And that can be up for a period of 18 months. A judge at that point cannot sentence them to jail time. It's just the 18 months of probation. And if they're successful again on that, at that stage, the conviction and the record expunged within 90 days automatically without them having to do anything. And then the last stage is if we have to make it there, is where a jail sentence can be imposed. This is also a stage where someone who may not be interested in engaging in treatment at the time, they're not interested in being on probation, they're not interested in the conditional discharge. They have the option to opt to skip to this last stage and agree to a jail sentence instead. And so that could be up to 180 days. They must receive credit for all time they serve, whether it's upfront or if they served any jail sanctions while they were on probation. It's 180 days, and while they might be sentenced to that, the bill also requires that after they begin that period of incarceration, that we must search for treatment opportunities for them, whether it be inpatient or outpatient. And it really puts that onus on our parole and probation department to search for those opportunities. And if one of those becomes available, the bill requires that the individual be approached about that and be given that opportunity to engage in treatment in lieu of serving the rest of their sentence. And I think Kiki is going to talk about kind of the plan they have in place, which I think is a good one to kind of transition somebody from that jail sentence into treatment and then back into the community. If someone after being engaging in or being released to do treatment instead of the jail sentence, if they don't comply, they can be revoked back into jail to serve the remainder of their sentence. And then again, even if we make it to this stage, the conviction and record has to be expunged after 3 years automatically. And I will hand it off to Rick.
Thank you. Good evening, everyone. My name is Rick Hawley. I'm the criminal unit supervisor at Jackson County Circuit Court. Mr. Green did a great job of outlining how these cases that aren't eligible for deflection or successful in deflection will navigate through the court system. I did want to share a visual of a flow chart from the state legislators that just kind of outline how that looks to give everyone an idea of how these can process through. A couple things I wanted to highlight on this is that you see at every step, like Mr. Green said, treatment is being offered. So if it's at the conditional discharge step, they're going to be offered treatment. At plea or trial, sentence, probation, they're going to be offered treatment. Same with the probation violation sanctions and probation revocation. Also on this chart, you can see for the 3 first stages, they're going to have automatic expungements after 90 days once they've successfully completed those programs. If they get all the way through a probation revocation, they still will get an automatic expungement. It's just going to be 3 years instead of 90 days. I did want to share some numbers on what's happening in Jackson County with House Bill 4002 having taken effect September 1st. So as of this morning, we've had a total of 155 arrests in our county. 64 cases have been filed with the court. Of those 64 cases, 8 individuals have accepted the conditional discharge. That's that first stage. And 6 of those cases have been dismissed in court. A breakdown of the arrests, you'll see that 57 of them were standalone DEM cases. The other 98 were a DEM case and additional charges. Some of those were serious charges. Some of them were felon in possession of a restricted weapon or attempting to flee a police officer. And when asked where we're at compared to other counties in the state, on the bottom chart, you'll see that Jackson County does have the second highest charges filed right now, behind Washington County, which is 84. We're at 64, followed by Lane County at 29. Multnomah, which is obviously population-wise the largest county in the state, is at 26. If we break our local numbers down a little more, agency-wise, of the arrest, 125 of them Medford Police Department, 20 have been Jackson County Sheriff's Office, and 6 Ashland Police Department, followed by a few single arrests with the smaller agencies in the valley. Substance-wise, the majority in our county currently has been methamphetamine, with 127 of the arrests being methamphetamine, followed by fentanyl with 9, and then other Schedule II narcotics 19. As you can see by these numbers, we're already seeing large increase in caseload based off House Bill 4002, and estimates have been anywhere from 1,200 to 2,200 caseload increase for Jackson County Circuit Court. At the rate we're going, it's going to be on the higher end of those figures. And with that, I'll pass over to Kiki from Pro.
My name is Kiki Parker-Rose. I'm the Jackson County Community Justice Director, and on the Adult Services side, we're the Parole and Probation Department for Jackson County. So as you've heard, I think repeatedly, the majority of the caseload that we're going to see to begin with is the conditional discharge. Patrick, I think, outlined pretty well that that's a 12-month supervision with us. Each person coming into supervision with community justice is going to be subject to a survey. We need to survey how they, what their needs are at the beginning of their supervision, and then we'll also complete that survey at the end of their supervision. Each person that comes to us will have a risk assessment completed, and we'll develop a case plan. And our priority is to get folks engaged in treatment. We know from what we've been doing for many, many years and providing our care and supervision to this population is that they're going to come to us with a lot of needs. Perhaps they're unhoused, they have barriers for employment or a number of other barriers. Community justice will address those barriers as part of our case plans and get them into treatment as quick as we can. Our officers are skilled in motivational interviewing and engaging folks in getting ready for treatment. And in addition to this, we have peer contracts in place already with our Pathfinder network and Reclaiming Lives in the community. Plus, we'll be working with On Track and ARC as well to try to get folks engaged in service as quick as we can. If somebody violates the conditions of their conditional discharge, we'll obviously try to use the least restrictive consequence available. But if we need to place somebody in custody, we can do that up to 30 days. We would not put somebody in custody for 30 days all at one time. We would likely use 1 or 2 or 3 days in order to create an intervention to get them safe and then back into treatment services. Once somebody completes their treatment, we would do an exit survey of them, and then we would notify the court to get them off of this conditional discharge as quick as we can. So it's up to 12 months, but if they come in and they do what they're supposed to do, we can return to court and ask the court to dismiss the case. And then we're required to notify the court immediately upon somebody completing the conditional discharge so that 90-day expunction period can begin. If for some reason someone's not successful on that conditional discharge and they return to court and then go through that court process, they can get up to 18 months of probation. We would provide similar opportunities for them, again, addressing those same criminogenic risk factors that we've identified in the assessment and case plan, prioritizing peer engagement and treatment. We also have another sanction capacity of 30 days. Again, we'll use the least restrictive means possible in order to affect behavior change. We'll continue to monitor the case plan. This population is eligible for what we call earned discharge in the state of Oregon. So somebody serves half of their probation sentence, and if they've completed all of those conditions and terms, we would submit their case for an earned discharge, getting them off of supervision as quick as we can, and again, providing that notice to the completion. This caseload, or excuse me, these cases are also subject to that 90-day expulsion that's been talked about before. So throughout conditional discharge and probation, there are lots of off-ramps and opportunities and pathways for treatment. And we will continue to make those referrals and do our best to get folks ready to engage in treatment services. If we have someone who is no longer interested in being on supervision, has not been able to successfully complete probation, we could return to court and ask for that 180 days in custody. As Patrick mentioned, there's opportunities for release while somebody is incarcerated to go into treatment within the community. Realistically, in Jackson County, we lack jail space, and so our plan is if somebody is revoked and sentenced to the jail, we would prepare them to move out to what's called our transition center, where we would have on-site services available, including peers and peer support and treatment. Our hope would be for that person to engage in those services for up to half of the period of time of their sentence, and then be provided an opportunity to go out into the community to finish the last half of their sentence. Those decisions were made by the treatment provider, the peers, and the community justice officers and probation officers assigned to those cases. If somebody is successful, we will notify, at the end of that sentence, we will notify the court of the sentence completion, and then that 3 years starts for the expulsion process.
Okay, I think we hit it like on the head, our 40 minutes. So we'll come off a screen share and then we will let you guys decide how we want to do our question. Maybe we'll come off.
You guys are impressive, I must say. That I'm amazed that you were able to have so many people speaking and keep it in that time frame. Thank you. And we have Andrew Hollenbeck who's looking at the chat. I will encourage folks, if you've been paying attention to the presentation and haven't had a chance to write your questions, try and see if you can do that now. And we'll start with the questions and keep going.
So one of
We're doing
the,
our
oh, sorry, thanks. One of the questions, some of the questions that came up were around housing particularly. And for one, there was mention about funding for housing from the legislature. Is that going to be for funding individuals? Is it going to be funding for construction of new housing? The other question about that is that how will this deflection program address the housing needs? Will that be part of the treatment planning process? And then, yeah, there's some more, but let's deal with those first, because I think those two were similar. And then there's a couple more after that. Anybody want to address those?
Oh, we're good. We're good, Vicki.
I can jump in on the housing. So unfortunately, there is a housing shortage. There's also a treatment bed shortage of all types and all levels of care. And those do make it much more complicated for our teams to sort it out. But that is one of the first things that the peers will do when they're working with the individual in that screening. If there's a housing need, the peers are going to be reaching out and trying to find resources for them. We also have emergency lodging for people who are on the wait list for residential treatment. that we can access. We don't have enough to fill the need, but that is absolutely a priority for our peers and our treatment teams trying to identify and find housing.
Our deflection program grant does have some funds for direct supports for participants. So whether that's getting an ID, some clothes, bicycle repair, emergency shelter, or transitional shelter, we have some resource there that we have not yet fully allocated out as we explore exactly what we need and where we need it. So there is some direct support that are coming through specifically for the participants in deflection. But this bill and this program doesn't necessarily do the kinds of funding that the question was aimed at in terms of funding to create new housing or new residential services.
So another question came out. So how will the county mitigate the risk of overdoses post-incarceration?
So we have some of those measures in place currently. So right now, people who are released from the Jackson County Jail, there's a jail release resource program that's in place that has a couple individuals, a team of people who are working to ensure that folks get connected to the resources they need in the community. Additionally, we have Narcan available for people upon release. If they choose to take that with them, they can really kind of take as much as they want when they're released from the jail. So our hope is that between the Narcan release program and that direct connection with peer support, we really hope that results in a little higher level of protection from that, what we know is really a risky time for overdose.
I'll just also add that from community justice, who has the majority of the post-conviction folks, we distribute naloxone at our department. We also partner with Max's Mission, and they're on site with us. We also have the ability for folks when they release from our transition center to take that with them. So we are doing our best to make sure that people have access to that as they're returning to community or already in community.
It's also an area of concern for Dr. Mann, our Health and Human Services Chief Medical Officer. Spoke this week to the local A&D Advisory Council about some other strategies to hope to come in the future in our community to address that issue that's beyond the Narcan component, how to get people connected with medication-assisted treatment as soon as possible.
So then there were a couple of questions about the unhoused community, talking about increased violence from police and having some mistrust of the police. So there's a little bit of question about, let's see, some accountability on the part. Okay, so it sounds like accountability and training for the police. And I know the livability team probably has some of that, but what is it? What are the parts of the program that will address some of these concerns about engaging with law enforcement to get treatment, but being afraid of law enforcement at the same time?
Yeah, I can speak to that. And specifically, I mean, I think that I touched on it a little bit, but the reason that I really believe that we're starting with the right group of police officers with the livability team and the outreach folks is that they have worked with that population for several years and really worked to build connections with them. We do outreach, like I said, twice a week. And that is mostly with community service officers. So it's not even our police officers that are present for that. And we partner with OnTrack, our La Clinica, several other service providers through that. To really do just that, to build trust, to understand that we're there as law enforcement, but we're also there to help them. That doesn't go, without saying that we take folks to jail. I mean, that is also a part of our job. We do have an obligation to enforce the laws, but we do that with empathy. But there's also an accountability piece. As we branch this program out and we start talking about deflection countywide, it will be a slow open to what that looks like. And again, we'll be kind of fluid with that. But I will, as well as Captain Aldridge, will probably be going to those departments and doing on-site training with them about what the program is. We're partnering with OnTrack and the ARC to bring in their peers to talk about what that program looks like so that law enforcement has a really good understanding of the expectations of the program, what we're asking participants to do, and that they can really approach it with empathy to fix the issues and to help these folks get the services that they need, and that's really the end goal for this.
Okay.
I'll add to that, that I think that's part of the reason that being so intentional with our opening is important, because that trust building can only result, and I'm talking trust building on both sides, from the person who's suffering from substance use disorder and the law enforcement officer who may be skeptical because he doesn't know that this is the right approach. I believe that that trust can only be built from a really focused and intentional program in which people can see relatively quickly that there's a positive result that can come out of this. And I really do think that we have the right plan for that to happen.
There's been a common theme that we've all talked about along the way with this, that this is just another door to treatment. So if an individual wants help and doesn't want to have police contact, we still have outreach peers out in the community for On Track and the ARC, that they can stop one of those peers who aren't accompanied by law enforcement officers, or come to one of our drop-in spaces and receive those services without ever having to have any contact with law enforcement officers if they choose.
So, let's see, there's a question about MAT. I have to, forgive me, I'm not sure what that is, but can MAT be continued post-incarceration, especially for folks on a wait list for treatment?
Yeah, so currently in the jail, and for some time, for the last few years, we've been continuing MAT. So MAT, for those on the call who might not be aware, is medication assisted treatment. So it's individuals who are receiving medication to help with their addiction. We have had the ability to continue MAT in the jail for some time. What has been missing was the opportunity to start people on MAT while they're in the facility. And so that's where the expansion through this jail, MAT and MOUD are kind of interchangeable. One is specific to opioid use, one is general for addiction. But this expansion through House Bill 4000 will allow us to start people new. But to answer your question, yes, we've been continuing for some time.
Okay. So another question on, are there going to be other places people can access? Will they be allowed other places to access treatment besides ARC or On Track?
At this point through Deflection, I mean, the warm handoff will be to one of those two agencies. But you guys can speak to it if you outsource.
Yeah, so basically their case managers will live at either On Track or the ARC, but those peers that are working with them will connect them with whatever service they prefer and have the ability to sign off on that as part of Deflection eligible.
If someone is arrested for has an arrest for a misdemeanor for drug possession in someplace else besides along the Greenway or in Medford, in another area, they're still under Jackson County, would they be able to ask for deflection? I mean, would that be something, if they know about it and they say, hey, I got this arrest, but could I enter deflection? Could I go into treatment and enter deflection?
So not on October 7th, but we really do think that's our first expansion step is a referral process. Again, we want to make sure we have it right and we have those pieces in place for that initial phase. But the very first expansion that I predict and this group has talked about is that we expand that to all available contacts to a sort of referral process. Now, that may look different depending on, right now this deflection is kind of a weekdays during the day type process. We don't have peers that are on call working overnight. That value was not in our funding stream. And so we think that referral will be the next big step, but it might be a referral to show up the next day. We're not exactly sure how that's going to look yet, but that's not far off.
That's coming. And then from the chart, it said that it looked like meth and fentanyl are the biggest challenges, and those are also really pernicious abuse disorders. Does the treatment availability match the challenges of those addictions?
I mean, I can't not say something about that. We have plenty of availability at lower levels of care. if somebody has, you know, moderate use and they can engage in outpatient services and we can hook them up with housing of some sort, then yes, there's no wait list for outpatient services. When you're talking about people who have severe substance use disorders, like a lot of our folks that are unhoused and are really suffering, detox and residential treatment are often, you know, one of the most critical things that they need. And there are wait lists for those services. So we're, you know, we have outpatient to bridge the gap until there's enough treatment beds to meet. But right now there aren't enough. And that's one of the gaps we're trying to fill with our emergency lodging paired with outpatient. So that, you know, we can give people the best supports while they're waiting for the right level of care.
Okay, and then someone asked if you could explain the difference between UM and DEM.
Just the people that invented the term, really, is all it is.
It's the same thing, just different ways to say the same thing. So UM is unclassified misdemeanor, and then DEM is drug enforcement misdemeanor, which is what the legislature referred to it in the House bill, but really ultimately what it is an unclassified misdemeanor.
So what long-term follow-up is planned?
But I think it depends. So we will be tracking the data, and we believe that this is going to be fluid from the first week as far as, you know, how we react within the next year. The biggest thing that I think it depends upon is what the support, and specifically kind of the financial support, looks like as we move into future fiscal periods. You know, we all believe that this is very important work, and we're all going to dump as many resources as we have locally into it. But we also recognize that we're going to need some help to do that. And so, you know, long term, I think I can tell you what the next 6 months or so looks like, and that is we constantly change what that target might be, and we figure out how the program works, and we intend to expand into other areas of Jackson County. Beyond that, I think there are a lot of external factors that are going to have to kind of come into play before we can answer that question.
Right. So the comment along with that implied that you might need some data collection to see where it's working, what's working where, that sort of thing. I thought I saw in the presentation there were some plans for some data collection along the way to monitor what's being successful, what's not being successful.
Andrea, could I make a comment from the legislative perspective on what's next?
Yes, you may.
Oh, thank you. This is Pam again. I just want to note, we, as Jeff described, we had a joint House and Senate committee put together to do the work that resulted in House Bill 4002. That committee has stayed cohesive. It is an ongoing committee at this point. It met over lunch days over the last couple of days and got updates. We can tell you that the state is on track to allocate all of the deflection money that was assigned to the Criminal Justice Commission. Programs are underway, they're robust. I expect that that committee will continue to gather input about what's going on the ground, will monitor data as it accumulates in the Criminal Justice Commission, and will very much be involved, I would think, on discussions around refunding the program in the next biennium. We think that the money that went out for deflection will keep everybody through the end of June of next year, which is the end of the fiscal year. We also know that we are going to need more funding to keep this going. As Senator Golden noted, our funding picture is quite murky at this point. However, I think I can assure at least this audience that there is going to be a very high priority in the legislature in including these programs again in next year's budget. We cannot afford to set up programs and then leave them hanging. And we hope that what the data will show us over the next 6 months is that we are starting to really see these programs work, connecting people with treatment, doing the good things we want to do, keeping our community safer. And with that data in hand, we'll be in a good position to refund the program, as I think will happen. So legislative activity It wasn't a done and gone. It's very much a continuing effort. And the final quick note is I just wanted to note, I put this in the comments, but the emergency or pre-treatment housing that Summer and her team have pioneered is showing such good results. I have been working with Oasis and Summer to put together a pilot program. We're going to draft a bill. We're going to ask for some money so that we can see this pre-treatment emergency housing that gets people who are homeless or people who are dangerously homed off the street for that little interim period while they're waiting for detox or they're waiting for a treatment bed. Be able to use that model in a much more broad way because it's really showing some good results. And I guess the last point there is, I'm so proud of this lineup of people that we have from Jackson County, and Jackson County has been on the cusp of innovation around substance use issues for a very long time. And I think I suspect many of the people in the audience are as impressed as I am in hearing the reports tonight.
Thank you, Pam. So how often or how many times can someone be offered deflection? So I can come and imagine somebody goes through the deflection program, they go through the treatment options, their things expunged, but they have a relapse, it happens again. How many times can someone be offered deflection?
If that person's willing and they've successfully completed deflection, they can continue to complete deflection as many times as it.
Okay, awesome. I think this question was answered. They say if someone's pulled over for drunk driving, they find a small packet of meth, are they eligible for deflection? They said diversion, but I think they mean deflection. But it sounds like that would be part of the expansion that you mentioned before. It's not necessarily something that could be in place now.
Well, even currently, assuming they were arrested for the drunk driving also, that charge would make them not eligible.
Okay.
Right? So,
Gotcha.
so your eligibility is limited to that misdemeanor and some of those associated charges.
But again, if they don't have a criminal history, they'll both be eligible for DUI diversion, which gives them the opportunity to engage in treatment if they're successful for the charge to be dismissed. And then for the drug enforcement misdemeanor, they would have the opportunity as well to do the conditional discharge, which would result in the same thing. So they'll still have an opportunity in that situation to avoid the criminal conviction.
Okay. Somebody mentioned that OnTrack and ARC are fairly high barrier treatment. And is the county considering any low barrier options?
Yes.
Yeah, that's a yes.
The ARC has services that are low barrier treatment. We can do assessments in the field. We can do peer support services anywhere it's necessary. We can help connect people with, our mental health providers or mental health providers at other agencies and have peers work with them without ever having to have an assessment prescribe that service, work with them from start to finish. Our residential levels of care may be a little bit higher barrier based on current availability, but all the other services are still very accessible.
Okay. Will there be weekly drug testing with the probation?
Now there's good. Oh, go ahead.
I can answer that.
The
So
probation.
with probation or with deflection?
Well,
With
maybe I misunderstood because I thought part of deflection was agreeing to going under a probationary period. I don't know if you call it that probationary period, but it's like a supervisory period. I guess so. Where will drug testing be in this program? Let's try that.
So first, I just want to make the distinction very clear, and it's confusing. It's confusing to us. I will, say deflection. You have not entered the legal system in any way. You are having an opportunity to complete treatment. And if that happens, literally the criminal charges get torn up and thrown in the wastebasket and it never happens. The probationary piece is if you either do not successfully complete deflection or you're not deflection eligible and you get released under that conditional discharge, conditional release. And that's when you go into the probationary. And so the part about the UAs.
I can talk about the UAs.
Oh,
I can talk about the UAs. So the drug testing in this, it is not, there's not random tests and there's no mandate for abstinence or that the drug tests show up negative for substances. There's a baseline drug test at the beginning that corresponds with the assessment, which helps establish the level of care. And there is an end of deflection UA as well. There's not randoms in the middle. That is also just for data, because we know that we're gonna want to know, like, are people reducing use or not reducing use? And it does not have a bearing on whether or not they complete the program, whether the UAs are positive or negative. There's just two, and therefore data.
Okay. And so it sounds like defense attorneys will not be a part of the deflection program, because that would only come in place if they weren't successful in the deflection program and then had to enter into the legal system, because the deflection program really keeps people out of the legal system. Is that correct?
That's correct. The court won't see anything on a successful deflection. Nothing will
Okay.
be filed with.
Okay, awesome. And so it's probably hard to tell at this point, but when will you start looking at expansion of the deflection program? Like, how long do you think you'll take for the small step before you start looking at expansion?
I can touch on this a little bit. And like I mentioned, when we had our training, even this morning, we talked about just the fluidity of what it looks like in communication. So if in the first couple of weeks we are not getting participants, we're going to look immediately at how do we expand this? How do we get participants into the program? And what does that look like? That'll be brought to the governance, and we can make that decision really quickly. The other piece, you know, in my mind is it would be great for law enforcement to have a couple of months to see what the capacity of the program is, how it's working with the peers capacity. And then after a couple months of that data collection, we can make a better assessment of how to open that gate, what that looks like for us in our county, and then we can move. I mean, my hope is, and I think all of our hope is, that we can expand as quickly as possible, and we will address week to week if we're not getting the kind of the amount of participants that we want. We'll look at how do we expand this now to get participants into our program, because we want to see the program work. We want to see it in action. So no participants isn't good news for any of us. We want to get this thing rolling. So.
Good. And then will there be, when it comes time for an expansion or these kinds of discussions, what kind of community or public input will you be looking for?
I think we're always open to public input, and we're really, you know, working to determine kind of what our boundaries are with that at this point. We're developing a web page that talks about deflection, and I hope that work with our public information officers will continue to keep the community informed about kind of what that looks like. We obviously can't have real-time data that is shared with the community about how many people are in the program, but we hope to update that fairly regularly. But I think that everybody at this table is open to input and thoughts about how that could look for an expansion moving forward. We just have to be real thoughtful and use that governance board and talk with our folks who are boots on the ground doing the operations to determine the reality of some of those things.
So some of the data that you collect on the program will be available through publicly eventually through an appropriate way on your website?
That's our hope, is that we can share with the community how it's going. And I think, you know, we have to have some discussion about privacy and how that looks. Obviously, we will never be able to give, you know, specific information about individuals, but nothing would make us happier than 60 days from now to be able to share an anecdotal story about successes within our deflection program. We would all love to do that. So I really do think that the community is going to be pretty tuned in, you know, those who are looking for it as far as kind of finding out about how this is going.
Right. So you've said how difficult it is to find enough treatment for people. Do you foresee, we talked about you just talked about having not enough, but do you foresee having so many people in deflection that they're not able to meet the requirements that they need within the 90-day window? And then what would happen if they
Summer
can't get
mentioned,
those, if they can't get those treatment options within that amount of time?
as Summer mentioned when she was talking, that the required treatment that is for deflection is readily accessible. There's no wait list for outpatient services, and there's no requirement for residential services for deflection.
Right, if we, as treatment providers, end up with more deflection, people coming in than we have capacity for, we would expand our treatment offerings to accommodate that. We can do that in outpatient. It's if somebody's waiting to get into a higher level of care, that might take a while, but they would still be meeting all the requirements of deflection with our outpatient teams.
Okay. Could you elaborate a little bit when you mentioned in there that the police, on police being encouraged but not required to offer deflection? Is that part of the law?
Yeah, I think the House bill, it says that deflection is not mandatory in every case. It's, we have a few counties in Oregon who are opting not to do deflection at all. And so I think there's that legal piece of it, but then also on a practical level, not every interaction that law enforcement has with somebody who's affected by substance use will be appropriate for deflection. We just know that. And so there's, like most things that law enforcement officers do at the time of contact, there's some discretion built into that. But we are really encouraging those teams who at least are the focus of deflection initially to have that conversation and seek out those people who are interested.
Okay. Well, we have reached the end of our questioning time. I'll turn it back over to Lori.
So I want to thank you all for coming and joining, the community members with their questions and interest, and all of the presenters. I learned a lot tonight, and for me, that makes me feel a lot more comfortable with what to expect is coming in Jackson County. I think knowledge is always helpful, and I read recent statistics in one of my medical journals. In 2024, Oregon was second in the nation for the number of adults with substance use disorder per, obviously, their population, and 45th for the availability of recovery services. So I know this is very ambitious, and I really appreciate the commitment that I'm hearing tonight. So thank you very much. And I will end our forum tonight by a personal story, which is that my father developed trigeminal neuralgia, which was a severe pain condition of the face after a head-on collision. And at age 76, he became dependent on opioids and anti-anxiety medication. He was able to get inpatient treatment, recovered, returned to work, and lived until he was 94 years old. So we were very lucky. And, when I think of this personal experience, I feel like everyone deserves this opportunity. And so it's very inspiring to hear what the plans that we have moving forward in our county. So thank you, everyone, for coming tonight.